Facilitate learner development and socialization is NLN Nurse Educator Competency 2. This outcome contains 7 objectives, and as we explore these, you will notice some overlap into other competencies as mirrored in the teaching learning environment. The first objective is to identify individual learning styles and unique learning needs of individuals with these characteristics: culturally diverse, including international, English as an additional language, frequently referred to as ESL or English as a second language, where translating and articulating can create challenges for ESL students. Traditional versus non-traditional, such as recent high school graduates versus those who have been out of school for a while. At-risk students, those educationally disadvantaged, learning and or physically challenged, social and economic issues. And those with previous nursing education, or education in general. Students with prior education, such as LPNs or RNs in a baccalaureate program, come with prior learning and can build on this in BSN programs. LPN to BSN and RN to BSN program designs facilitate progressive learning. Accelerated students usually come with more refined thinking and decision making, differ in backgrounds and prior experiences, and may have additional financial and other commitments beyond academics. Here you see listed the competencies underneath. Competency 2, the objectives B through D. B is provide resources for diverse learners to meet their individual learning needs. C is advise learners in ways that help them meet their professional goals. And D is create learner environments that facilitate learners' self-reflection, personal goal setting, and socialization to the role of nurse. Objectives E, F, and G here are foster the development of learners in these areas: cognitive domain, psychomotor domain, and affective domain. Assist learners to engage in thoughtful and constructive self and peer evaluation, and encourage professional development of learners. Two A, identify individual learning styles and unique learning needs of learners. This slide looks at learning styles. Later slides will build on these slides with unique learning needs of learners. You may be familiar with the VARK learning styles, as it is frequently used with entering students to help them identify ways they best learn. A VARK questionnaire is available online, free for educational use, that can be used to identify your students' learning preferences. The goal of your classroom would be to incorporate at least one strategy for every learning preference. The oral learner preference is to listen or hear, such as in learning classrooms with discussion, debate, and the like. A kinesthetic learner prefers hands-on, as would occur in a skills lab or clinical area. Those who like to read and write, the preference is for text or words, for example through note-taking or essay questions. And then the visual learner prefers graphics, pictures, and other visual representations. This slide shows learning preferences as identified by the Kolb Learning Style Inventory. There are tools that can be used to identify learning preferences, and this is one of them. This one is included in the Certified Nurse Educator Review Book. Hawk and al. Provide examples of strategies related to learning style preferences. Learners preferring concrete experience benefit from clinical and lab experiences as well as lecture. Those who are reflective observers benefit from reflective journals, questioning, and participation in discussion. Abstract conceptualization preferences benefit from a project, reading, and building models. Active experimentation benefit from case study examples, lab, simulation, and clinical experiences. These students can be risk takers, so it behooves the educator to know which students in the clinical area have this preference of active experimentation. These are just a few examples, and the viewer is encouraged to review further information in assigned readings. Two A1, culturally diverse. Further information here is used. The culturally diverse term is broader than ethnic or racial characteristics. Included are gender, age, race, generational differences, in addition to ethnic and racial diversity. Gender applies with the nursing curricula tending to be female biased with pronouns and examples. Male students benefit from male role models and additional support from peers. Using curricula that's gender neutral will support both genders. Age and generational differences, such as Generation X, whose parents were baby boomers and they are self-sufficient and strive for balance of life and work. These students like change in technology, and this is where Google and YouTube originated. Generation Y, millennials, are team-oriented followers, optimistic. For these students, provide structure and prompt feedback. Generation Z, raised with technology, these students like interactive group learning, experiential and objective. Multiple commitments of non-traditional learners lead to need for support services and flexibility in the curricula. Ethnic and racial diversity needs to be supported through inclusivity in the classroom. Use of case studies and role-playing to practice communication, followed by discussion, can foster cultural competence. To determine bias, you can click on this link or copy this link down and go to this website, and it will help you identify your own cultural biases. For international students, often a TOEFL exam is required for English as a second language. A cutoff score is used to determine if students have adequate skills to be successful in an English-speaking classroom. Provide resources for diverse learners to meet their individual learning needs. The American Disabilities Act, often referred to as ADA, provides for accommodation of students with a documented disability. This could include more time for testing, a quiet room, a reader, and the like. Role models representative of diversity in student body and in faculty can be a resource to students. Support services such as tutoring, writing lab, counseling, and the like help diverse students or students with diverse needs be successful. An advisor serves as a resource for students to help them meet professional goals. These are some of the ways an advisor provides support: listens, assists with problem solving, advises course sequencing and number of credit hours each term, provides guidance with academic policies, and refers for non-academic needs. Competency 2D is to create learning environments that facilitate learners' self-reflection, personal goal setting, and socialization to the role of nurse. Luparill quotes Kolb's learning theory propositions as a way to support learners. The first three are: learning is more of a process than a set of outcomes. Learning occurs as students examine and redefine their values and beliefs in light of new ideas. Disagreement among ideas drives the learning process. And number 4, learning is a process of adaptation to the world involving changes in one's thinking, perceiving, and behaving. 5 is learning involves transactions during which new experiences are assimilated into existing concepts, or existing concepts are understood in the context of new experiences. Learning is a process whereby knowledge is actually constructed by the student as opposed to merely transmitting fixed ideas from teacher to student. Competency 2E is foster the development of learners in these areas. The cognitive domain. The cognitive domain is related to thinking processes as reflected in the 6 levels of Bloom's taxonomy: knowledge, comprehension, application, analysis, synthesis, and evaluation. A student needs to know and understand nursing knowledge, though that alone is not enough. The student must be able to apply and analyze information, synthesize a large amount of information, especially in acute care setting, and evaluate at a higher level of thinking. As is discussed in Competency 3, test questions must be at the higher levels of thinking in the upper ranges of the taxonomy to be successful, effective nurses. It is not enough to just know and understand the information. Foster the development of learners in these areas. And this is the psychomotor domain, which relates to physical functioning, such as what is needed for CPR, and using different types of equipment, such as an infusion pump. And then the affective domain relates to feeling and valuing that is carried out in actions, such as caring is an approach to patient care and used in interactions with others. The subcompetencies 2F assist learners to engage in thoughtful and constructive self and peer evaluation, and 2G encourage professional development of learners, have some overlap. Arrange opportunities for students to give constructive feedback to peers, including positive feedback and suggestions for improvement, and have them do self-evaluations, modeling areas to be included. Foster civility through positive interactions and feedback, avoiding rude or insulting comments. Identify acceptable classroom and clinical behaviors in course and student policies, given the diversity of learners, some of whom will not be aware of what is acceptable behavior. Competency 2, facilitate learner development and socialization. We have touched upon some of the more important components of this multifaceted competency. I recommend you revisit and read further about any new areas as identified on the lesson page. You, as a nurse educator, foster learner development and socialization. The next slide is a list of references used for this presentation. Thank you.